Hello, everyone. Welcome to join our Saturday online webinar again. Okay, so today we have Elaine here and then me, Raymond also. So hopefully you're still not bored with me. All right. And then today we have new faces also. Yeah. All right. And then today we are going to talk about aphasia management in acute setting. So basically it's about hospital setting. So before we start our online webinar, so let me introduce our Facebook page first. So actually, our Facebook page is called Aphasia in Malaysia. It's a platform for all the public to share about aphasia related information, stories. We also discuss about challenges or any obstacles that you face along your aphasia recovery journey. And we also welcome your successful stories and also your strategies and also your tips that you find very effective in helping people living with aphasia. So we do welcome your feedback and your whatever comments or whatever questions to us. So we are more than happy to help you out. And today we are so honored to have a new face, not Zizi anymore. All right, so
For having me
um,
here.
yes, so Elaine, we have Elaine with us today. So she's going to share with us about aphasia management in acute setting and basically the hospital setting. This is very quite a very niche topic, but most of the patient living with aphasia will go through this period that is hospitalization period, meaning after you got your stroke or after your loved one having any forms of brain injury. So of course, the first moment they will be admitted to the hospital, and then suddenly they found out that they cannot speak anymore. So they have aphasia. So what to do? What to do? So then you will look at the doctor, and then the doctor will give you a lot of instructions, telling you, okay, you go there, go here, go there, go. And then they take your blood, and then they put a lot of pipes or a lot of staples, on your head, whatever. So and some of the people, some of the patient might have to go undergo operations and so on. So in this case, in this kind of situations where actually it's quite traumatic, I believe, yeah. So because you don't know what the doctor is going to do with you, and someone now you have this aphasia condition, so you cannot talk anymore, you cannot express yourself. So who can help you actually? You see, sometimes family members will try their best to help you, but somehow because of aphasia nature, so you can't express yourself anymore. So I think speech therapies can do something to help you to go through this dark period. So today we are so lucky to have Elaine to share with us, and she is a speech and language therapist. Currently, she's working in a hospital setting, so she's more than qualified to share with us this topic with us today. So without further ado, let me pass the stage to Elaine. So Elaine, whenever you're ready, so the stage is yours.
Firstly, thank you so much to Mr. Raymond for the kind invitation to us.
Yeah.
Also, thank you for the opportunity to share with everyone today. I'll try my best.
Yeah.
Okay, so today I want to share with everyone about aphasia management in acute setting. So next slide, please. So just a very quick recap on what is aphasia. No, aphasia basically means a language impairment or a problem with the person's language. So the person might have a problem understanding other people, a problem when he or she speaks, a problem with reading and writing. So it is usually caused by injury or damage to the brain. For example, after a stroke or brain injury due to an accident or a cancer, and it can happen in different degree of severity. Some patients might have a very mild problem. Some can have quite a severe problems. Sometimes actually patients may not even be aware that they have a problem like this called aphasia. So just to give you an example of how it's like to be having aphasia. So now a person may be thinking about the object star, and he wants to say the word star, but what comes out is actually the word moon or the word stairs. So it's unintentional. It's not something that the person is doing intentionally, but because of the problem with his language, that's what happens. So next slide. Now, today I want to share in particularly about managing aphasia in acute setting or acute care. So what does acute care means? Acute care actually refers to services that's provided to treat very sudden and very unexpected or urgent episodes of injury, illnesses that if left untreated can lead to severe consequences like death or disability. And oftentimes all these patients require very rapid intervention. They need to be seen very quickly. They need treatment very quickly. So some examples of people who may need acute care are people with stroke, people with breathing problems, or they had fit or seizure, they had burns, or they had very bad wound or cuts. So they need very immediate medical attention. And usually the first place that these people will go is the emergency in the hospital. And sometimes these patients may come to us with multiple medical issues. Can be a few problems at once, so may not only be one problem. So for today, we will be focusing on what we call inpatient management. Basically, it means that patients who are admitted in the wards. Next, please. So how would a person with aphasia be having difficulties in the hospital? I think earlier on, Mr. Raymond actually gave quite a good introduction on how it really happens. You know, these people, for a start, they are usually living a relatively normal life. Suddenly one day something happened, a stroke happened, or they were caught in an accident, and their brain is injured. And then they had this aphasia problem, they had this language problem. So it mainly affects them in two areas when they're in the hospital. One would be a difficulty understanding other people, and the other would be a difficulty trying to express themselves, meaning a difficulty actually trying to say what they are thinking. And most often than not, the people that they will need to communicate with in the hospitals would be the doctors, and nurses, and other staffs taking care of them. So next slide, please. So what would be some of the patient's communication needs in terms of understanding other people in the hospital? Most of the time, the patient will need to be able to understand instructions given by the doctors or nurses, or questions, doctors asking you questions, people asking you questions in the hospital, or information. The staff explaining to you certain things that they want you to understand, certain procedures that they are going to do. So all of this can be a problem for a patient with aphasia. They may not be able to follow the instructions. They don't understand the questions that you are asking, and they don't understand the explanation that you are giving to them as well. So
Yeah,
next slide.
especially I think especially when they, like some of when we are in a hospital, I think we will come across of a lot of new vocabularies to us, like a lot of names of medicine, a lot of names of procedures where even previously we didn't even hear about that. No, what's more, if a person has aphasia already, I think, wow, this can be very, very torturing kind of communication, between the patients and the therapists, and also the the medical personnel also, I believe.
Correct. So it can be quite a very overwhelming situation for the patient. You know, you suddenly find yourself in a
Yeah,
strange
like
environment.
yeah, like for example, if let's say doctor say, okay, now okay, you got a stroke already, so you need to go to do CT scan. So like how can the family members to help the patient understand better? Okay, now you need to go to CT scan, instead of we just we just push them to the CT scan room, and then suddenly they do a lot of procedure things without telling them. I think they'll be so panic. They will become like a wood, like a log already. So how can actually the family members help to explain to the to the loved one with stroke? Okay, now you're going to CT scan. Where they cannot understand you.
I will answer this question in more details later, but just
Okay.
for simple idea, so we often try many different ways. Besides telling the patient, we will show perhaps pictures or images. And nowadays, we all have our handphone, right? So you can very easily search up a photo of the CT scan and just show it to the patient. So it helps the patient understand better actually.
This is a good idea. This is good idea. All right. Okay.
So now that part was about understanding other people. Now let's talk about what the patient may want to be telling other people when they are in the hospital. So they might want to be asking about their basic needs, meaning they could be asking for water, they could be asking for food. They may want to also be telling other people about the pain or discomfort that they're feeling. What type of discomfort? Are they feeling dizzy? Are they feeling like they want to vomit or any other discomfort? They could also be trying to look for a person. They want to talk to doctors, they want to talk to their families or any other persons. They may also want to be requesting for certain objects. They might need a pillow, they might need a blanket, they want their handphones, or they need a spoon. And they might also want to be put in a different position. So you should understand that a patient who goes into a hospital may not be as independent as they are before this, especially patients with stroke. After the stroke, they might find themselves being unable to move one side of their body. So they depend a lot on help to actually move them to prevent any pressure sore. They might also want to be asking for help regarding the environment. If it's too noisy, if it's too bright, they might also want to be asking for information. They want to know where are they now, what time is it, who are you. They will also have a lot of needs to express their feelings. They might want to tell the doctor that I'm feeling very confused now, or I'm feeling very shocked with the news that you're giving me and everything, or even many other specific desires that they may want to be telling the people that they're talking to. They want to go to the toilets, they want to stop certain treatment, no, don't continue and everything. And all this could be a problem for them when they have aphasia and they can't clearly express what they want.
So normally, like based on your sorry for interruption, I like to
No problem.
All right, because suddenly I suddenly thought of these questions. I believe most of the families will think about will want to know also, like, based on your experience, because like patient with aphasia, they cannot express already. So normally in the ward, in the hospital, how these patients actually express themselves, without, before the speech therapy, what normally you will see from them?
Usually,
That's,
what happens
yeah.
is they will do a lot of gesturing.
Okay.
Yeah, they will do a lot of pointing. Some of the
Like,
patients are actually quite innovative. They will have a lot of their own gestures. They'll do this. They'll do this to get the message across. Basically, actually, or some of the patients, if they are able to, they type.
yeah. So if let's say they want to go to the toilet, so normally, what will you see how they actually express to you? They point to the toilet
Yeah.
clearly. Okay, that's very
They will
good.
point to the toilet, or as they call the nurses there, the nurses will
Mm-hmm.
usually ask the basic few questions like, are you cold? Do you want food? Do you want to go to toilet? Do you need water? And as the question is being asked, the patient just needs to nod or shake their head lah.
Okay, that's good. All right. Next slide, right?
Yes. Okay, so what does the speech therapist do, or how can a speech therapist help this patient, right, in this setting where the patient is being admitted in the hospital? So usually it always starts with a referral being received. So the doctor will make the referral to the speech therapist. In simple sense, it basically means the doctor telling the speech therapist, hey, we have a patient here. I know the patient needs your help in terms of their speech and language. So come and see the patient. So the speech therapist receives the referral, and then they'll go and see the patient in the ward. So that's the different thing about your outpatient clinic and everything. So we go to the ward and we see the patient. So usually the first step is actually assessing the patient's suitability. What that means is to actually see whether the patient is suitable for us to start any assessment or treatment. Suitability, some patients may not be suitable. For example, if their medical condition is still not stable, they're still in quite a critical condition, or if the patient is still quite confused, they are not alert, meaning we couldn't really wake them up, or they are still not able to cooperate. So all these conditions may result in the patient not being suitable at that time for us to actually carry out any tests for their language. But if the patient is suitable, then the therapist will then proceed, usually firstly with some form of tests. Case history taking, they will ask the questions, they will ask the patient information as much as the patient is able to provide, and then they will be assessing the patient's language. They will test which part of the patient's language is having problems. And after that, the speech therapist can then provide some treatment or therapy, or provide some other methods for the patients to communicate themselves while they are in the hospital. And at the same time, the therapist can also provide what we call caregiver education and training, meaning we can help the caregiver to understand better what is the patient's problem, why is the patient unable to speak now or having a problem understanding other people now, and also teach the caregiver how to help the patient in this situation.
Now I see a question here already. I see a problem here already. Okay, that's a problem. Okay, not for you lah. The problem not for you. Okay, because now it's it's during MCO periods. There's a lot of hospital has a lot of SOP. A lot of caregivers and family members are not allowed to go to the hospital. Then any other ways you provide the training to them? You cannot be like you demonstrate them from your the blog, and then the family member have to watch outside of the building like that. So what will you do normally?
In our hospital, there are also certain restrictions in terms of visitors because of the MCO and the COVID and everything. But the training is still being provided, but in a limited sense because no matter what, if the patient is going to be discharged, the caregiver still needs to learn the necessary things. The hospital still needs to teach the caregiver necessary things. So usually what we'll do is we will call the family to arrange for certain appointments for us to meet at certain time so that we can provide the training.
Oh, will you use teleconference like that to train the caregiver, things like that?
It's a possibility, but at the moment not conducted at my hospital yet lah. But I think that's a good idea.
Okay, I'm just asking, see whether it works or not. Nowadays, because all these online stuff actually is very, very common nowadays. I just wondering if we can use it, when the patient is in hospital. Yeah.
So after the therapy and the treatment, when it's time for the patient to be discharged, meaning the hospital is discharging the patient can go home. So then the speech therapist will provide recommendation or suggestions on what to do next. So if the patient is already well, the patient has already improved enough and is able to return to normal in terms of his speech and language, then the patient will be discharged from us. But if the patient still needs further treatment or therapy, the patient then has several options. They can continue as an outpatient, meaning they come back to see us at our clinics after they are discharged home, or they can be admitted to the rehab wards, or they will be admitted to other rehab hospital or other rehab-based center available outside.
Okay. So can they call you personally or not for consultation? Some patients they prefer certain therapies, so probably they want to ask for your personal contact. So would that happen or not?
Will that happen? My personal experience, sometimes it does happen.
But I think because of hospital is has some rules and regulation. I think most of the hospital do not allow therapists to give personal contact because right. I mean this is my logical thinking, because it's like there's some conflict of interest I think,
yes,
right?
Correct.
Yeah. All right. My question is finished. Okay. All right. Next one.
So just to show everybody what it would be like to be having speech therapists in the hospital. So very much different from having speech therapists outside at home, nursing home. So the hospital environment is something quite different. You can see that there are a lot of beds here. Usually the hospital will be quite busy. There'll be a lot of patients around. There are going to be a lot of staff. There are going to be doctors, nurses, everybody going around. Different procedures happening at the same time for different patients. So the environment can be quite noisy and distracting. So it may not be the best environment for any therapy to happen, but we try our best. And usually how it happens is the therapist will probably be at the patient's bedside, and then the therapy will be conducted while the patient is seated on the bed.
Oh, you mean they will be sitting at the edge of the bed, and then they will have the table. I think you call it cardiac table here, right? I saw
Over
that.
bed table.
Over bed table. Oh, all right. Okay, that's a good name for it. Over bed table. Okay. So you have the Sorry.
Whether the patient can sit on the edge of the bed actually depends on how stable the patient is. Usually, we may not ask the patient to sit at the edge. We will just put the bed up, and the patient will be on the bed.
Oh, I see.
And
So
then
you
we push
prop
the
up the
table
bed.
in. Yeah.
Oh, I see. All right, that's a good idea. Good. All right.
Okay, so next slide. So lastly, I would just like to share with everyone some general strategies to help this patient communicate better, as I mentioned previously, right? Okay, so I think most importantly, firstly, is to obtain the patient's attention. You want to be getting the person's attention. You want to be keeping eye contact with the person. So make sure that it's not too dark to be seeing each other. As much as possible, you try to reduce the noise in the environment. Maybe you pull the curtains, okay? Don't speak too fast, but you don't want to also be dragging your words. You just want to be speaking slower, but not dragging it, okay? You're going to keep your sentence short and simple, but adult-like. So don't talk down to these patients, because actually these patients are pretty much it's just a problem with them understanding you, or a problem with them speaking, but they are very much the adult that you still know them. It's not like they become children, okay?
So you mean like talking down is like you don't talk like talking to a kid, is it? Like, for example, if you want to drink water, so you want to nan like that, things like that.
Yeah, no, you should avoid that.
All right, okay, yeah. I think that's very, very important. Sometimes, aphasia. Sometimes patient with aphasia, they look like becoming like a kindy kid already, because they cannot talk already. So they use a lot of gestures. They use a lot of. Sometimes they just vocalize a lot of like vowels, right? Yeah, so it overall it looks like a kindergarten, not even kindergarten, sometimes probably preschool age children, right? So then some family members might think that, okay, I need to talk to their level, okay, so I talk at the preschool age level. So I have to teach them A for apple, B for boy, like that, things like that, right?
Yeah. You shouldn't do that lah.
Yes, yeah.
Essentially they are adults. They understand pretty much like an adult. It's just that their language function is being impaired actually. So I'm sure that you wouldn't want people to be talking that way to you. So that's how we should be treating patients. So and then repeat some keywords as needed. To better help the patient give you a more accurate answer, you can try to ask yes/no questions or multiple choice questions instead of an open-ended question. So it will be easy just to give you an answer that way.
So like multiple choice meaning like ABCD, four choices, you mean? How many choices here you mean normally?
But it depends on your questions, right? So
okay,
so
all right.
if you're going to be asking the patients, let's say sometimes just for us to assess the patient's awareness, we may ask the patient question like, where are you now? Can you tell me where are you now? Are you at home? Are you in the hospital? Or are you at the shop? So then the patient can just point to you, whichever answer they think it is. However many options is up to you lah, I suppose. And also up to your questions.
Yep.
So you'll be surprised that some patients actually work quite well with this form. Yeah, they understand you. It's just that they can't tell you. So you provide the answers for them to choose from.
Okay.
And besides that, you can also use some gestures, some visual, what we call pictures, like I mentioned before. Use facial expression and sometimes writing as well, which may help to get your message across better, which may help the patient to understand you better. So you use all this to aid the communication to be carried out.
So you will ask the patients to use the left. I mean, like for example, if because most of the stroke patient with aphasia, they have the injury on the left side of the brain. So most of the time, their right side of the body is has some weakness there. So you ask them to use which hand to write, left hand or the right hand, or
for patients whose dominant hand is already affected. Usually we can provide if the writing and reading is still intact, usually we can provide an alphabet board instead, so that they can point and they don't have to write, which is something that I'll show you later.
Okay, good.
So it works both ways. You can provide other methods for the patient to express themselves. You can allow the patient to write, to type, or use a communication board. I'll show that to the audience later. And for you to get the message across to the patient, besides telling the patient, you can also use gestures or pictures or writing to help the patient understand you. So it works both ways, actually. Okay, so always give the patient time to answer or to speak. They might need a little bit more time, so you want to just be patient, give them a bit more time. And ask the patient if the patient wants help before you start to cut in, if possible. Okay, so next slide, please. So this is what a communication board might look like. So basically what it is it has certain pictures or certain words already available, and the patient just needs to point to the one that they want to be telling you about. So this can be in the form of a hard copy or sometimes in the form of electronic devices like your tablets. So next slide.
Yeah, because I saw a lot of contents, a lot of choices here. It's more to hospital-related pictures, right? A ventilator, breathing tube. I think this one is very suitable for patients still in the hospital for them to use to communicate, right? I think when they go back home, they cannot. I mean, they hardly use this kind of communication board already, right?
So the communication board will be changed depending on the patient's needs,
Okay.
Okay, so next slide. So this is what a simple alphabet board would like. So the patient can just point to the relevant alphabets to spell instead of writing. So
I think most of the time we have to teach the patient how to use this, right? Because sometimes when you show them this kind of board, I don't think they will know. Most of the time, I don't think they will know how to use it, right? Because they have aphasia already.
True. For the communication board and this alphabet boards, you probably need a little bit of teaching and also a little bit of patience.
Yeah, I think we also not only teaching the patient, we have to teach what do you call that? We have to teach the medical personnel to how to use also. I think this is very important. Otherwise, one party know, the other party don't know, also got communication breakdown. So no point using all this communication board, right?
So sometimes we also have to educate the staff to help them to be aware that all these options are available to the patient. The patient can talk to you through these options so that the staff is aware that, that's how the patient is communicating with me.
Yep. Oh.
Okay, so that's the end of my sharing today. Thank you, everyone.
Time flies. Let's see any questions here. Okay, now I think Flo doesn't have much question at the moment, but I have some question for you, Elaine.
No problem.
Yeah, thank you. But I think this kind of questions, I believe most of the family members would want to know. So if our loved one, having a stroke or, has some brain injury because of the car accident or because of the fall, you see, when they are admitted to the hospital, a lot of things happen. And most of the time, communication will be overlooked now until they come across then when they communicate with them. Suddenly, I cannot talk to them like normal way already, like what I used to talk to them already. So then only they know how they would they will think that they will be thinking how I should communicate with them. And now, there's sometimes they will. I come across a lot of family members that try a lot of ways to communicate with them. They will use communication board to talk to the patients. They will use different ways lah. A lot of innovative, like you say, innovative, very innovative and creative. But sometimes I believe with professional help, there will be a lot of shortcuts. There will be a lot of simpler way and more effective way to communicate with patients with aphasia, especially in hospital setting. But the point is, now, okay, at this moment, we need speech therapists help already. So because we need professional help. What is the best time for the family member to tell, hey, doctor, can we invite speech therapists to come in to teach my my loved one, okay, my dad or mommy or my whoever, how to talk again? What is the best time do you think we can invite the speech therapists to join?
I suppose like what was mentioned previously, usually the first thing that we look at is how stable medically is the patient. If the patient is medically stable, if the patient is quite alert, meaning
so you meaning like medical stable, meaning do you mean that like blood pressure is stable, or all the figures on the machine is very stable, like heart rate or whatever? Do you mean that those figures?
Probably something a little bit beyond that. Pressure wise, yes, depending if the pressure is too high, okay, that may be a concern. Sometimes medically not stable, meaning the patient might still be having quite a critical breathing problems. The patient might still have very bad infection ongoing. The patient might still be having a lot of problems at the brain. Sometimes the stroke is still not, the effect of stroke is still not settled. The patient is still pending for surgery and things like that. So the patient is in quite what we call quite a critical condition at that time. So that time then may not be the best time to be starting speech therapy. That may not be the main concern at that time. Other concerns may take precedence. They might want to settle.
So like you say stable, so like for example, can you give us like more example, like what the family can see like so-called stable? Like probably like you say breathing difficulties, so might not be suitable for speech therapy. So meaning when they are breathing is more stable, of course we need to get feedback from doctor, right? To clearance from them.
I think supposedly the most easy thing for the family to look at is one, whether the patient is able to actually stay awake or being alert. A lot of the times the patient is at still quite a medically unstable stage. They might be quite drowsy. The patient is able to stay quite awake. I suppose that's the first good indicator. What time is, if you are not sure when is the best time to start, then I think the family can just tell the doctor that they have this concern with the patient. Ask the doctor to make the referral. The speech therapist will come and assess the patient.
Yeah, after all, you will still assess their suitability. After your assessment, you will discuss with the family members like how far we can go, what kind of goals we can have for now. Maybe not so intensive drilling at this moment. Every day have to learn a lot of words during the hospitalization period. While they still have to be suffer from a lot of procedures and all those things. But I think there are still simpler training, simpler exercises the family can learn from speech therapies to help them to go through this dark period in the hospital. Because the environment in the hospital, I don't think people will like it, like we have, you know, a lot of medicine smell, and then a lot of what do you call that, the machine sounds, and a lot of procedures, where you don't know what nurses or the doctors going to do to you. So a lot of all these uncertainties, I believe, a lot of patients very, it must be very panic also, and you know, some more they cannot communicate already. I think psychologically they will be, you know, very, it's extremely suffer.
Quite stressed out
Alright.
situation. Yeah.
Yeah. All right. Okay. Good. I think no more, no, still no questions from the floor. But it's okay. Thank you so much, Elaine, for your informative sharing with our
Oh,
audience. You know, at
thank you
least
very
to give,
much.
yeah, to give a public some idea, you know, whenever your loved one having a stroke or brain injury, other forms of brain injury, once they got into the hospital, so you still can get help from speech therapies. You don't have to wait until, okay, my loved one go back home, then only I get speech therapy. I don't think so. A lot of times we still can get the speech therapist help, you know, to get simpler, to get some directions, you at least some tips and strategies, like what our, you know, Elaine shared just now, to communicate with loved one with aphasia. Because all these tips and strategy looks very easy, I think doing it is totally different. You know, I believe we come across this kind of experience once we have taught the family members all these tips and strategy. uh, Listening it, understanding it is very easy, but when we're doing it, it's like very, it's a different story, right? Okay, it's like, you know, for example, you want to use gesture to communicate with, you know, with your loved one. I don't think it's very easy to a lot of family members, because like throughout the previous like 10, 20 years, they haven't been using this kind of way to communicate. So I think it's good to have your you know, speech therapists to join in the I mean, during the hospitalization period, at least maybe not with a daily session, probably just weekly session, you know, just to get some ideas, some directions, how the family can help the loved one to go through this dark period. Because being able to express themselves, I believe, is a very satisfying, very pleasurable experience for the patient. They will relieve a lot of stress during the hospitalization period, I believe. All right. Okay. So thank you so much, Elaine. And also thank you for all the audience for joining us our webinar today. And if, let's say, if you have any more questions, please do comment under our recorded session later. So we'll be more than happy to answer you. All right. Okay. Then for the trailer, next week we're going no not next week. Okay, we try to do it more regularly, so of course another 2 weeks times later, so we're going to have another interesting topic. Is about AAC. So we're going to talk about how we can teach the patient how to use different gadgets or different this communication board to communicate with your loved one, or you know, vice versa. All right, so please stay tuned with us for more updated information. So see you again, and have a good night, have a good weekend, and bye bye.
Thank you, everyone. Good night. Stay tuned to the webpage. Thank you.